Hello, everybody. Coach Quincy here. I'm so sorry if you joined earlier today. I completely messed up my time zone. So, we are going to talk with Stephanie today. She is an electrolysis. So, let's give her a few minutes here. In fact, I'll see if I can request her in. Let's see. Hello.
Hello.
Hi. Sorry, I messed up the time zones completely.
Oh no, totally okay. I was like, I didn't know what state you were in at the time, and
Yeah,
so I didn't even catch it. Like
yeah.
it just,
I'm just gonna blame it on my pregnant baby brain. Like,
uh, hey, do it while you can.
well, I'm usually, and I might have Googled like our time differences, and I may have compared it to like time in Texas,
Oh
which
no.
is where I actually live, but I'm here in Maine. So I'm like, oh, did I mess up that time? So thank you for being patient with me.
We're good. We are good.
Awesome. Well, I'm glad you joined me today. I love talking about all topics, PCOS and everything. And I think I found your profile probably, it was either a hashtag PCOS thing, or maybe you were commented on another person that is of PCOS and that kind of thing. So, up until probably recently, I didn't even really know what electrology was.
No.
So if you could just kind of dive into that for me, because when I think about like hair removal, for
Hmm.
example, I think of just like laser hair removal.
Yeah,
Um,
which you are not a candidate.
yeah, yeah. So can you kind of elaborate on what like electrology is and like the difference?
Absolutely.
Um,
So we're going to
yeah,
talk a little bit of the science behind it. So we have
yeah,
laser when we're talking about like permanent results. Okay, we're talking about electrolysis is FDA approved for permanent hair removal, and laser is FDA approved for permanent hair reduction. The reason we can't say removal with laser is that you have to have a candidacy for it to be most effective because the light is attracted to melanin, the melanin is then targeted and breaks down the hair. But if there
okay,
is no melanin to be attracted to, nothing will happen. And this is why red hair, blonde hair, gray hair doesn't work with laser. And this is also why thin hair doesn't work with laser because there's not enough of a target source. Okay.
yeah,
Electrolysis, on the other hand, is we use a very fine filament, a very tiny wire that we insert into each individual hair follicle. And then in inserting that hair follicle, we take heat and chemical change and break down the root structure of the hair. So the reason that we can say permanent with electrolysis is because you are inserting something into the follicle, your target is always reached, does not matter what it looks like, because you put something in the place to do the work.
okay,
So when I'm talking to patients about like, how do we make these decisions, right? It all comes down to the work in front of us. So I do both laser and electrolysis. I've been doing it
okay.
for 19 years. And I make those decisions every day based on the work in front of me.
Mhm.
So just breaking it
Yeah,
down with chemical change and heat.
yeah, cool. Cool. And
Yeah.
like, so how would somebody like find an electrolysis, like,
So
in their area? Like,
this is my favorite thing to talk about. So one, yeah, electrologist is what we are.
hmm
Electrolysis is what we do. And electrology is what we study. So how to find an electrologist is you can go onto websites like electrology.com, which is a database of certified professional electrologists all over the globe. Or Society of Clinical and Medical Hair Removal also has a great directory. And these are organizations that help with continuing education and make sure that their electrologists are up to date on the current standards of practice. And they have membership boards that you can find. The other way is Dr. Google, right? Go
yeah.
onto Google, right? And we type in electrologist near me or electrolysis near me. That way you can find someone that is a practitioner or a clinic near you. But
Gotcha.
how to find somebody certified is the harder part.
Yes. Yes. Yeah, it's really, really interesting. So, how many treatments would someone need? So I think the biggest thing with PCOS is hirsutism for a lot of women. So they have, that male pattern hair growth, especially around the jawline or around the lips. Um, so like what would make somebody a candidate? Like you said, like for me, I'm lighter skin kind of thing.
Mm-hmm.
Um, like would other laser therapy,
Mm-hmm.
would they be, a candidate? Like what makes them a candidate for?
So laser, like I said before, it goes after melanin. So the darker the
Okay.
hair, okay, the more you can do laser, but also the larger the target. So if we're
Okay.
talking severe hirsutism, which is the stuff that we're going to see in our PCOS pattern growth, if it's beard growth, then what you're going to experience is you could get some laser therapies as long as you're a candidate. Now, that's going to come from a consultation, okay?
Hmm.
And not all technicians are well versed and cross trained. So it's going to be something that we really have to focus on here. That cross training is incredibly important. If you don't know when to use the right tool, it becomes harder to find a clinician near you that can take care of the job. So
Yeah.
when you're going in and like as an informed consumer, what you want to make sure that you're doing is you want to make sure that your technician, one, adheres to like higher effective infection prevention standards. You want to make sure that they're keeping their clinic clean, okay? They're staying on top of their continued education, and they understand the technology that they're working with, okay? Those are the three things that you as a consumer need to focus on. On the back end, the technician then assesses your needs. Okay, so for example, if you came to me, and we're going to use you as an example because you're really prime candidate for electrolysis. If you came to
Hmm.
me and you said, "Hey, Steph, I have male pattern beard growth through my face, okay, and I have blonde hair, and I have been shaving, plucking, waxing every day of my life for, let's say, since going into puberty." Okay, what you need to then focus on is the frequency of the technician focuses on is the frequency at which you've been doing that previously, so that we can tell you how many sessions you'll need to get it cleared the first time, and then the frequency of those sessions once we've cleared it the first time. Your
Okay.
first sessions are going to be the hardest because depending on the level of hirsutism will depend on how long it takes to clear a face. Okay, so let's say if you came to me and you're like, "Stephanie, I have a full beard, I'm waxing like once a month my entire face, and it's severe, it's like from cheek to lower neck, okay, all of this," then I'm going to tell you that clearance will take probably up to 4 months to get you through the first clearing, because we can't aggressively treat your skin, because one of the balancing acts of electrology is giving you just enough current to destroy a hair while still preserving your skin's tissue. So a
Gotcha.
lot of people are like, I mean, hirsutism, we both know, it can be crippling for a lot of people. And
Hmm.
so one of the big things that you face is we need to balance that out and make sure that you feel like we're getting rid of the hair, but you're still going to have beautiful skin after we do. Because some people say, "Oh, crank it up to 11 and let's just kill it all." But the
Hmm.
problem is you could compromise your tissue, and then what was the point? Okay, so
Hmm.
we can throw a lot of clearance time at you, but if we compromise your tissue, what was the point? Okay, because then we're battling something else. So most people, let's just talk about like that timeline. Your very first question was how many treatments? There is no number of
Yeah.
treatments because that treatment timeline is dependent on how much you come to me with. I'll tell you, when
Hmm.
I first started getting electrolysis for myself, I started on my upper lip. Okay. I started at 12 years old, and that was before really seeing the effect of what hormones were doing to me. Okay. So I started here. A clearance was probably 30 minutes to get through my whole upper lip. I used to go to the dentist before the treatment. My mother would take me to the dentist, and my mother's also an electrologist. She would take me to the dentist. We would numb my mouth, and then we would clear my lip, and it only took 30 minutes. And I got that done in about a year. But that was before hormones really hit the wall, right?
Hmm.
Now, when I turned 16 and this stuff started really amping up, that was like 2 hours worth of treatment. And I did not have the pain threshold to deal with that at 16 years old. So
Yeah.
to clear it, I couldn't do that because it was too much pain for me. Okay. So
Gotcha. Okay.
we would do it in small patterns, 30 minutes, 30 minutes, 30 minutes, all the way through my face
Gotcha.
to get it better. And that's when that number of
Yeah.
sessions thing gets bad. Because that's like, that can really rack up.
Gotcha. Wow. Did you hear that on your end?
I did. I was like, dance music.
I'm like, decline. Like, I'll talk to you later. So, so you mentioned like the pain tolerance and everything. Is there like a numbing cream you can use and stuff like that for those kind of treatments?
There's numbing creams. You can pair up with a doctor and have a doctor numb the area, or a nurse, depending on your state's uh, oh my God, what's the word I'm looking for? Practices. There we go.
Okay, yeah.
So depending on
Yeah.
your practice, will depend on what you can do. When I first started, I used to get, like I said, the dentist to block it. And then later in life, we brought on a nursing staff with a medical director who could administer lidocaine injections. So our practice offers lidocaine injections administered by a medical
Gotcha.
staff. Okay. And
Gotcha.
then for some people,
Yeah.
numbing cream was enough. Numbing cream was enough for my cheeks,
Yeah.
for my neck. I had no pain threshold, and it was too much.
Yeah. Gotcha. Yeah. So that varies person to person and then also state to state, whether or not you can do that or not. Yeah.
But we have
Because I'm
people that
also
will fly the states for us.
let's say that again.
We have people that fly across the United States for our practice because we have the lidocaine.
Oh, wow.
So like we have women with PCOS fly in frequently, and they'll do a full clearance, and then their home electrologist will manage what we've cleared with smaller sessions, so it's less painful.
That is so cool. That is so cool. That's such a neat, like, and also just to know like the community and then that's available to you. Like if you have the means to go and do that and travel. So that's
Absolutely.
really cool. Very cool. So like, is there any, I guess, like risk involved in doing, you mentioned the skin thing. So like you don't want to, you can damage the skin if you do too much or if it's at a higher level. Are there any other risk like skin pigmentation stuff and
There
that kind
is.
of thing too? Okay.
There is. So one of the things I'm gonna, after this post, and you're more than welcome to like reshare when you see this kind of stuff, there are before and after protocols that you do need to follow. There are contraindications with practice as well. Okay. One of the most common ones is women who are pregnant. They can only have thermolysis done, and we request that you have a doctor's note, only because, especially in the PCOS community, we work so hard to get pregnant, right?
Mm-hmm.
And we don't want to put that risk on the electrologist, right? That something might go wrong. The thing is like there isn't anything that could go wrong with thermolysis, but since it's not scientifically studied, we say no. Okay. And that's because who's going to study on someone who has struggled to get pregnant if electrolysis is safer? So that's really up to you and your comfort level. But because there is no wavelength through the body with thermolysis, you can do it during pregnancy as long as your doctor approves it. Electrolysis itself. So you have electrolysis, thermolysis, and blend. These are modalities of electrolysis. Electrolysis and blend use galvanized current to go through the body and activate the sodium hydroxide within the follicle and change that to lye. So it's a chemical change. So we don't want to pass something through the body that would interfere with the fetus as well. So that's why we do thermolysis. Thermolysis only is heat directly at the tip of the probe, and there's no activation through the body. And then the blend is a combination of the two, but it still uses galvanized current, so you don't want to do that. And then contraindications, people with melanin-rich skin, okay? Anytime we get injured, we send more melanin to the area. You can end up with hyperactivation of that melanin called hyperpigmentation. And then you could, if you hyperpigmentate and you pick at it, you could remove some pigment, and that is called hypopigmentation, which means that we remove the pigment. Hyperpigmentation will reduce. Hypopigmentation, you can't put it back. So once you take out the pigment, it's out. But if it's gotten darker, it'll lighten back up.
Gotcha.
And then, so hyperpigmentation, redness and swelling, those are common. Sometimes you'll have a little bit of a histamine reaction just because I'm irritating the heck out of your skin to kill that hair, okay? But they're all things that will resolve after treatment. It just takes time. I do not like to work on patients who are on Accutane because it is very rough on the skin. So I forego that until you're off of Accutane. That depends on the technician of how long you should be off of it. I tell my patients 3 months. But if you're on any photosensitives, hyperpigmentation is higher.
Gotcha. Is that like the main medication that you would or like not treat with? Or are there other medications out there too that are kind of fun? So that's the main one.
Yeah, that's the main one. Everything else is pretty cool. I mean, if you're on a retinol, if you're on a photosensitive medication like antibiotics, you're going to have hyperpigmentation during that time. Okay.
Yeah.
Will it go away? Yeah, it just takes time. If you're in a sunnier state and you're not wearing SPF during your electrolysis sessions, you're going to have hyperpigmentation. Does it go away? Yes, it just takes time. I'll tell you a funny story. Back when I was in high school, I had hyperpigmentation all across my forehead, and it was the week of picture week. And it was one of those things, like, I didn't follow protocol. And as you guys can see, this is filter free. Okay.
Yeah.
Within reason. But it goes away. It just takes months, if not up to a couple years for it to go away.
Wow. Yeah. Yeah. And so is there anything like you would recommend? Because I think I saw this in another one of your videos about like not doing. So basically, like if you have like 1 or 2 hair growths, like don't tweeze it or tweeze it or don't tweeze it.
Okay, you'll see every electrologist and laser technician do one of these numbers when you say tweeze, because it's like, ooh.
Yeah.
Okay, so tweezing, waxing, threading stimulates blood flow and stem cells. If you're okay with giving yourself a longer treatment plan, then I can't tell you what to do, right? But as your professional and guiding you through your investment, the more you tweeze, wax, and thread, the longer the process takes, because it takes time to break down that follicle that's always constantly being stimulated by the injury. So we want to discontinue that. You can shave, you can trim, you can nair, you can bleach. I'm not a big fan of nair because nair does really cause a lot of like chemical burns on people. They don't do spot testing and that kind of stuff. But it can be done. You just have to be really careful with it. Like, you got to spot test that stuff, especially when it goes on your face.
Yes. I actually did that recently because I'll have like 1 or 2 hairs really for me, and I will usually just pluck them. And then I saw your video beforehand. You're like, don't do that. So then I had some bleach. I was like, well, let me just try this one, and I did okay. So I did a couple spots. So
okay.
I did a couple spots.
One of those funny ones where you're like, ugh.
Yeah.
Your eyebrows are going to change shape. We all remember what our early 2000s looked like and how thin the brows got. Clearly they came back a little bit, right? Some of that's makeup. But if you're tweezing hormonal hair growth, which is going to be anything along this line, you have a higher propensity of increasing your growth. And if your PCOS is unmanaged, it becomes higher.
Gotcha.
Other big things, I know in the PCOS community, we talk a lot about reducing our testosterone levels through stuff like spearmint teas and that kind of stuff. Yes, they will help possible future growth, but if it's been stimulated, it's hard. You'll be hard pressed to get that to reduce using spearmint teas. It will be great for managing in the future. Like, if, say for example, you know that your body could possibly sprout up some hair, that spearmint tea will help reduce that. But the amount that you would have to drink for severe levels of hirsutism, it's pretty high, and nobody's going to drink tea.
Yeah. I agree. What about like spirolactin? I know a lot of women get on that for kind of lowering those androgen levels. Does that help with the hair growth and everything?
Hair, but it's going to help. Okay, so you also have 3 types of hair. Okay, so we have talked about 3 modalities, and then we have 3 types of hair. We have vellus, accelerated vellus, and terminal. Accelerated vellus and vellus can be managed through spironolactone, finasteride, Vaniqua, some birth controls. I'm not a huge fan of those, but it can be managed through that. But the fact is if it goes from accelerated vellus to terminal, and that means basically, so if we think about the density of a hair, a terminal hair would be what's on your underarms. Accelerated vellus tends to be what's here on your forearm, okay? And then vellus tends to be what's on the cheeks when it's not a hirsute case. That being said, you can't really reduce the volume of the accelerated vellus of your hair of your arms except through something like spironolactone. And if you have been doing anything to stimulate growth, it's hard to change it.
Yeah.
Yeah.
Yeah. Gotcha. And
but
like with somebody,
it's worth it.
Yeah. It is if it's like, out of hand and you need that for lowering those androgen levels. So like would somebody come for electrologist just for the facial aspect, or are there other areas where you would also do work on? Like you said, mention arms and the whole thing.
That whole thing.
The whole thing.
Everywhere on your body. The only places that we don't go is inside the nose and inside the ears, because we need to be able to see the entry point of our hair follicle. If you think, if I can't see like the entry point, then I can't get to it. So that's why those are not great. The other thing is inside the nose, that's part of your danger triangle. Your danger triangle is basically this zone. It's a higher propensity for bacteria problems and go straight to your brain. That's why we don't do that as well. Okay. But you name it, I've zapped it. Okay. Same thing happens with laser, but with laser, you don't want to go anywhere near the eye with laser. But in many cases, I call laser like, that's my large volume, right? That's my workhorse. It's going to get in there and it's going to be your full legs, your underarms, your bikini Brazilian. It's going to be like the big stuff. Sometimes your forearms, not your upper arms, not your back, not your stomach and chest, because in most cases, it's just not dense enough.
Gotcha. Yeah. Because I've had in my past, this was probably like over a decade, I had laser hair removal for like underarms and bikini line. And it probably because of my like hair is lighter and everything, it definitely didn't, it lasted for a while, but it's definitely come back since then. So so I think, and I had quite a few treatments with laser at the time. So I think like
it came back is just because you weren't truly a candidate. I mean, when I assess somebody for laser hair removal, if, for example, your hairs, the color of the hairs on your eyebrow, you're not a laser candidate. Okay. Now, will it help reduce the volume? Will it make your life easier? Will it make it easier to shave? Heck yes, all day. Let's do it. Right.
Yeah.
But you're going to be the person that goes for laser and you maintain a reduced volume of growth. It's only to go to electrolysis for the remaining portion of it, if you want it permanently gone.
Right. Gotcha. And that would be like the permanent solution is really electrology. Electrolysis.
Electrolysis.
Trying to get the terms down right.
That's all right. You know what? I love this because at the end of the day, that's the number one thing. People are like, what do I call you? And I'm like, my name's Stephanie, but like, it's electrologist. That's what I do.
Yes.
Electrolysis, so.
Yes.
Laser's easy. You just say laser and everybody knows what we're talking about.
Yeah. Exactly. But it is more in depth than just laser. And there is a difference, right? Because there's also, you can just get your laser certification and you can also increase your education and do electrology, right? Like there's a big difference. Yeah.
So laser training in most cases, now it changes state to state. I'll tell you. The laser and electrolysis certification across, let's just call the US, okay? Across the US is all over the place. But most electrology programs are between 320 and 1,600 hours, depending on your state, okay? Some states like, I'll give you like Arizona and Washington, Colorado, Texas, they're unlicensed states and they don't have an hour requirement. Unfortunately, somebody can go buy a machine off eBay and call themselves an electrologist and have zero training. Okay. We don't want to do that because we are inserting a heat-based filament into a follicle. Don't do that to yourself. But at minimum, for you to get national certification, you have to have had 320 hours underneath someone who is also certified, which is how my program works. And then you can sit with them for a year and get your certification after a year. Or you can go and be on your own and then get certified after 5 years of being on your own. So there's like high levels of hour requirements.
Gotcha.
With laser, it's like 24 to 40 hours. In Arizona, you could like be Joe Schmo off the street, go for laser training and go be a laser technician tomorrow.
Yeah.
But like in other states, you might have to be a nurse or a doctor. In other states, you have to be laser trained. And so it's definitely like you have to be certified. So yay, you can fire a laser safely. But that hour requirement is pretty low.
Yeah.
Yeah.
Yeah. And I've seen you wear like the loops, the magnifying glasses. So do you can actually see like the follicles in there and you can kind of zap them as you go along? Yeah.
So
does it take a while? Like, is it like instant?
So with electrolysis, you're working between a half a second to like 4 to 8 seconds per follicle, depending on your modality. And the loops just help you see the entry point to your hair, because obviously proper insertions means you hit your target properly and then you damage the target properly.
Gotcha.
So that's kind of a cool part. I have been a loops user. Like I said, I've been doing like 19 years. So I've been using loops for probably about, let's say 15 of the 19 years. I didn't start off with that. And I train my girls to use a magnifying lamp to start with. And the reason I do that is because loops are an investment. So
yes, they are.
Give people a heads up. Like when you become an electrologist, your electrologist is investing in their success. Okay. That's from the table that they use, the loops on their face, magnification that they use. That's the machinery that they're using. That is the sterilization procedures that they're using. All of that is an investment. And so when people think, oh, it's just so easy, anybody can do it. The average person walking out the door, and this is with training, like official training, plus a startup of their business, it's an investment of probably about $25,000 as just a starting point. That's to get you like everything you need plus your training. You're probably looking at about that. Okay.
Wow.
And that's not like your advertising. That's not any of that kind of stuff. That's why we all kind of work online, you know, and talk about this, because that's an affordable means. Lasers, effective lasers run you between 50 to 150,000 for an effective laser. So when you have somebody that is doing this as a profession, they're doing this to make sure that they're giving you the best possible treatment. The loops themselves are like, I know, a tiny $2,500 investment.
Yeah.
Right. And that's why we're so protective of them, because we're like, oh, everything is to do this, but we love it. That's why we do it. But I definitely want people to know that the reason the price tag for electrolysis is what it is because everything we're doing is setting you up for a medical environment.
Right. So. Right. And then just touching on the price point and everything, is it typically sold in like a package? Like if you were to go, they would sell like a package, or is it kind of like per treatment?
Per treatment. Definitely.
Per treatment.
And anybody that's watching this, and I know that we only have a few eyeballs now, but when it's online later, you guys come back and remember this. Package pricing is okay. Okay. But the thing is we can't estimate your number of treatments. So if you're purchasing a package of, let's say 50 sessions or 10 sessions, and you need 15 minutes one session and an hour the next, that package doesn't break down right. But what you can do, if you're like, say for example, tax season hits and you want to put $2,500 towards your electrolysis and whittle away, that might be up to the electrologist and you to do that way. But most electrologists have had poor experiences with this kind of stuff in the past, and we don't tend to do that. It's just treatment to treatment. You afford what you can do, and we will grow your treatment plan to make it work for you.
Gotcha.
Yeah.
Yeah. And then hopefully,
we want it to, it will work. We want people to feel confident about their plan. You got this. But I definitely don't like doing packages for electrolysis. I'm barely a fan of packages for laser. If you do
Yeah.
more than 3 sessions for laser in packages, it's difficult because usually you average between 6 and 8 sessions for completion. So what would a package be worth, right?
Right.
So pay by the treatment.
Pay
It'll
by
benefit you
treatment.
guys. Yeah.
Got it.
And I'm not a fan, I'm saying this out loud, I'm not a fan of hair removal memberships.
Yeah.
Everybody watching, no hair removal memberships. And the reason that is, it goes back to that at the end. If they're putting you on a membership to pay a certain amount each month, they're now in charge of that financial sum. And what if you don't need it? When
Right.
you don't need it and they got your money, they're not going to give it back to you. Okay.
Yeah.
And they will fight you tooth and nail for that kind of stuff. So don't do packages and don't do monthly memberships because that's their money now. And
Yeah.
either it goes towards a service or it's a wash.
Yeah. And in that case, like if they were to say like, you don't need it or whatever, they might not say that if it's like a monthly thing. Do they do more damage than good by going in and trying to find hair follicles or,
They can.
you
I
know?
mean,
Yeah.
like, it's more like they do more damage here than here in
Yeah.
those settings because you just feel like, can I ever get out of this? Am I always going to be in debt to this system? Electrologists and laser technicians that really love what they do, they're going to tell you, let's just walk this one step at a time. Just like
Yeah.
personal trainers. I mean, like the fact is
Right.
like they're doing it because they're passionate about what they do. And their goal is to get you to the next step and like keep you accountable to the plan that you two set forth in the beginning. Electrologists are doing just that. We are sitting there going, okay, these are our goals. These are the goals that we want to attain now, 6 months from now, a year from now. How can I help you break that down? Most of my patients are with me between a year and a half to 5 years, depending on whether or not they have their hormones managed or not. Okay.
Right.
So during that time, it's like, okay, if I see that we're going to have a big hair problem in front of us, I want to make sure that they understand that like my goal is to work with what's bothering you first and stair step you into permanency in new areas. We don't have to eat the whole elephant at once. That's like my favorite, one bite at a time.
Gotcha. Wow, this has been super informative. I feel like I learned so much. So I really appreciate you jumping on here with me today. Do you have any like last final words or the final advice for anybody like looking for that kind of treatment or looking for hair removal treatment?
We're talking to the PCOS community. My friends that are PCOS diagnosed. First things first, I want you to get with your endocrinologist, okay? Because electrolysis can only work as well as your hormones are balanced, okay? So working with an endocrinologist, and we all know here in the States that that's a specialist, which means that you got to get to your PCP or your gyno first to get your referral.
Right.
But, or your NP, that's what I work with. But like work there first, get your referral and get into an endocrinologist. Keep track of what your body is doing, okay? Manage your symptoms as much as you can, whether that's lifestyle choices, okay, medicinal choices, or a combination of the two. That management will help the success of your electrologist, okay? From there, trust the process. Every person that has gotten into electrology usually gets in there because we too suffered with hirsutism, or we had someone that we really cared about that did, or we were raised in the industry. Okay, it's like you don't just kind of like, oh, I think I'm going to be an electrologist tomorrow, because it's such an interesting career. But we want this success for you just as much as you do. So trust that. Stay consistent to the treatment plan. If things fall out of place and you can't stay consistent, remember that the damage of those follicles is done. And as long as we're not re-stimulating growth and keeping our hormones managed, that you should still see success until you can resume treatment. You can pause at any point. You'll be okay. It doesn't matter whether it's a life event, a financial change, or just you don't have the time, right? You can pause and resume when you can, okay? But that doesn't mean that your success is gone. It just means that we're taking a pause and we'll resume when you're ready, okay? And last, if you are looking for somebody for electrolysis and laser, I teach it, right? So at the end of the day, reach out to me. I'll try to help find you someone near you. But if you can't get a hold of me, because I do teach all day, right? I want you guys to consider going to like the Society of Clinical and Medical Hair Removal or the American Electrology Association and find an electrologist and practitioner near you. These organizations do a phenomenal job of continuing education. They do a phenomenal job of making sure that their directories are kept up by people who care about what they're doing. Okay, so go those places and they will take good care of you, finding you somebody near you.
Perfect. I love that. And I love that you mentioned like, yeah, take care of the hormone bit first, like see the endocrinologist and fight for it, which sometimes you have to because some
It's a good
people,
fight.
primary care will, yeah, you have to be your own advocate. So that is really good. And how would someone find you online? Is it just
So
Instagram for you?
Instagram's Instagram and TikTok are my two primaries. On Instagram,
Okay.
I'm the_zap_master. Okay.
Mhm.
And on TikTok, I'm Stephanie Shields CPE. Okay. And those are the two places that you'll find me on the line. I do have like many other platforms like my YouTube and my Facebook and that kind of stuff, but they all kind of feed into the same deal.
Yes.
I gave you my link in bio that they can
Yes.
go click, find me, get a hold of me. That's a great way as well.
Mhm.
And then
Awesome.
my website, which I can type into the chat here. Hold on.
And then I can put it in the notes too.
There you go. AZ Advanced with a
Awesome.
D Electrology. And that's how to get a hold of me for continuing education if you're an electrologist or a practitioner. I do trainings for practitioners that aren't electrologists all the time. If you want to know more about what we do, you're welcome to purchase the same platforms and get yourself well versed in it. I have for electrologists, I have a mentorship program that we meet every Saturday morning and we do like a little powwow about like, like this is what we're facing and go from there. And then that's pretty much, those are like my main programs: education, continuing education, and mentorship.
Love it. Love it. Awesome. Well, thank you so much. I've learned a lot.
Anytime. And if you guys have questions, she knows how to find me.
Yes.
So,
Yes. Alrighty. Well, thank you so much. Have a good night.
you're welcome. Peace, love, and hair removal.